Hey, I'm Dr. Michael Lange. We want to age as gracefully as possible, don't we? So is there enough evidence out there that proves that certain specific nutrients, ingredients, or supplements can enhance, our skin, our joints, our hair, our nails? And there's a lot of great science that's come out recently with marine collagen tripeptides, riceramides, hyaluronic acid, and there's a new supplement called Dermaval. Well, we've taken all four of those and we've combined it in a supplement called Rejuvenate. 3 delicious flavors, chocolate, cherry vanilla, pink lemonade, and then we have it unflavored for those of you that want to just put it in your coffee in the morning. It's worth a try. I endorse it, obviously, 100%. If you don't like it, we'll give you money back. It's as simple as that. So check it out at fortify.com.
Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortify Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 813-282-8283. That's 813-282-8283. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host as usual, Dr. Michael Lange of the Lange Eye Institute and Fortify Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, or a nutritionally related topic. So don't be shy, pick up the phones and give us a call. It's myself and Dr. Susan Summerton is my co-host this morning. And Dr. Summerton hails from the Lange Eye Institute and Fortify Vitamins. She's also a board-certified optometric physician, certified nutritional specialist, and a diplomat and a fellow in the nutritional arena. So we got two doctors to answer any and all questions you may have regarding any eye care-related issues or health-related issues if it regards to nutrition. And anything else, we'll try to answer it to the best of our ability. We've been hosting this show since April of 1993. Folks, that's over 30 years. So the live call-in number is 813-282-8283. That is 813-282-8283. And who's Dr. Michael Lange? Once again, I'm a board-certified optometric physician. I'm a certified nutrition specialist. I founded Lange Eye Care and Associates March 15th of 1993. and the Lange Eye Institute a few years after that, and Fortify Vitamins a few years after that. And like I said, I've been hosting Ask the Doctor since April of 1993. Just recently, we got some accolades. We were ranked the third top medical talk show to Dr. Phil and the doctors, and we got third place. And I got to toot my horn a little bit there, and that is because we got a great show, and Dr. Summerton is one of the reasons. I like to say Dr. Summerton is our asset. Good morning, Dr. Summerton. How are you?
Good morning. I'm calling in from the Villages, close to the Lange Eye Institute here, and you really have callers. It's been a really 30 years. It's just amazing to think how many hours of chatting. I wonder how many words you've actually said in that amount of time of just talking. That's amazing.
Time flies when you're having fun. It is amazing. It really is. I remember I started on Ask the Doctor. It was called Sound Off with Dr. Lange. Country Jim Kirk gave me an opportunity in Ocala, Florida back in the day. It was a 30-minute show. He gave me an opportunity, and it was a good show. He says, son, you got your own talk show. And it was actually a community service in the beginning because I didn't have any money back then. So, Country Jim Kirk, if you're listening up there in heaven, thank you. A lot of my success is directly related to you and Mom and Dad for having me. All right. Once again, I'm going to give you the phone lines twice. If you got a question, give us a call. It's live. 813-282-8283. That's 813-282-8283. And this is like the end of March, so you know it's a live show, 2025. And I also want to thank David Snow. I was a guest on his show this morning, and David Snow has been hosting a talk show, the Dr. Health Radio, and you can check it out at drhealthradio.com. David has become a friend of mine, and he's been hosting the show even longer than me. He's been on, I think, over 33 years, and he started in Hawaii, and he's on this show. We were on at 7 o'clock this morning, and you can listen again on this network, on the Salem Media Network, at least, on 8:60 a.m. today at noon, and again at 7 p.m. in the Tampa Bay area. So we had a good interview this morning. We talked all about nutrition for anti-aging, for the eyes, for sports nutrition. So I want to thank David Snow on Dr. Health Radio Network for that interview. It went really well. You guys can tune in again at noon and at 7 p.m. here if you're in the Tampa Bay area. But it is good morning, good afternoon, and good evening, just depending on what part of the world you're actually watching us or listening. We are coast to coast in the United States on a multitude of radio stations, so give us a call. You can learn more about what we have to offer and the supplements we're involved in, the research, the evidence-based, fully transparent supplements that we've developed, and that's at fortify.com. Fortifeye, fortify.com. And you can go to the science section to see the studies and the research, why we put a specific nutrient or a type of nutrient in a particular supplement. So check it out at fortify.com. I'm going to give you the Fortify phone numbers. And I think Charlene is answering the phones this morning in Ocala for the Fortify Center. And that is 866-503-9746. That's 866-503-9746. And Dr. Summerton and I did it a little bit with a twist last week. And I do want to thank iHeart Radio in New Orleans, and that's WRNO 99.5 for letting me host Ask the Doctor Live last week from New Orleans. It was a great show. We had lots of local calls, even some calls from my old stomping grounds from my own old high school. And I also want to thank Dr. Summerton for co-hosting the show from New Orleans. And of course, the Salem Media gang. I mean, AJ and Venetia and Joe, they pulled it off. It was amazing. So thank you, guys. That was kind of fun, wasn't it, Susan?
It was. We did it with little Cajun twist there, focusing on foods that they eat and just their lifestyle there. And we did. We enjoyed it. And I hope the callers hopefully did too.
Yep. So all of you New Orleans people are probably listening next week to this show. So maybe we'll come back down and we'll be all live in the studios there again and host Ask the Doctor from New Orleans coming up. And also there was a caller last week that called me regarding his son that had some cancer, and we were kind of trying to help him out with some philanthropic issues. So I did email you. A lot of times my emails will go to your spam. So please check your spam if you're listening this week from today. I did email with a reply regarding your son. All right. Once again, phone lines are open. It's 813-282-8283. That's 813-282-8283. You're listening to Ask the Doctors. So we opened the new wing on Thursday at the Lange Eye Institute. It went really well. So I saw patients on the new side. Dr. Summerton and Dr. Caputi are on the regular side. We've invested in some state-of-the-art equipment for both sides. So we've got some amazing technology now at the Lange Eye Institute. And we have some technology that no other doctors have in the state of Florida yet. So we're real excited about that. And I'm including ophthalmologists, optometrists, and optometric physicians. So come on by the Lange Eye Institute if you want the latest and the most advanced eye care possible. The Lange Eye Institute is located in the Villages, Florida, where a large building, it looks like a plantation on the Mississippi River, and it's located on County Road 101 and 466, right in the heart of the Villages. It's called the Lange Eye Institute. We're open 5 days a week, and we're on call. And we're going to be on call a lot more lately. We've worked out with an urgent eye care deal in Texas where we're going to have almost 24-hour coverage. And that's Dr. Brooks. He might actually be calling in later on in the show for about a 5-minute segment on what we're going to be doing with him. So come on by the Lange Eye Institute. I'll give you the phone number for the Lange Eye Institute. I'll give it to you twice. Write this down. We got a lot of new technology we're going to talk about in just a second that will help you, especially if you have dry and baggy eyelids. And we're going to expand on that. We're really excited. But the phone number for the Lange Eye Institute is 352-753-4014. That's 352-753-4014, Lange Eye Institute. So one of the most recent additions to the Lange Eye Institute is called the Lumenis Opti Light. Okay, I'm going to hold up a picture of what it looks like. So the Lumenis Opti Light is a state-of-the-art, only FDA-approved IPL unit for dry eye. IPL stands for Intense Pulse Light Therapy. And we have one of a select in the state of Florida right now. It's a painless, non-invasive, in-office treatment that treats the underlying cause of dry eye, all right? So if you have something called meibomian gland dysfunction, these are little glands along the lower and upper eyelids that get very clogged as we mature, but also if you're young, they can get clogged. And so it targets these meibomian glands, and what it does, it zaps it. Some people think it's a laser, but it's an intense pulse light, and it zaps these areas, and it breaks down all the inflammatory components that are inside the glands, and it allows the glands to secrete the healthy outer lipid layer that is crucial to reduce dry eye symptomology. Remember, the meibomian glands, if you're deficient in this meibomian, this lipid layer, the tears evaporate, you get very dry and irritated, sandy, gritty, burny, teary, itchy eyes. If you don't have the oils in the car, the cylinder seizes up and the motor basically blows up, right? So you got to have the oils in your eye. And a lot of you, those glands are not working. And you've tried everything. Think about it. You tried hot compresses. You've tried almost every prescription drop on the market, every artificial tear. You've even had procedures done like LipiFlow, and still you have chronic dry eyes. I urge you to consider IPL, Intense Pulse Light Therapy. Find a doctor that has the Lumenis Opti Light as the only FDA-approved device for treating dry eye. And it's called Lumenis Opti Light. We do have one at the Lange Eye Institute. And we're going to talk in a minute about some of the testimonials from the people that had it done yesterday. And it is really exciting to be able to offer this to our patients, isn't it, Dr. Summerton?
It is, and we spent a lot of time training on this, and we're always searching for what we can do better for dry eye, because we know many of our patients struggle with this on a daily basis. And this is really taking it to the next level. It really enhances what we call cellular function in the eyelid. So any of these eyelid diseases that we're seeing on a daily basis, it can address the microbes, which is like the demodex that people have heard about, bacteria that are all around the eyelids. It is, our eyelids really accumulate around our eyelashes. They're meant to catch everything to prevent it from going into your eye. But because of that reason, a lot of stuff gets stuck in those eyelids, which is right by what you call those, you addressed it, the meibomian glands that hold the oil. So what this treatment does is basically like a rehabilitation of those meibomian glands and help release all that stagnant contents that have been in there just through light therapy. And we use these special filters. There's even a sapphire crystal there. It's amazing technology that is just, we do basically, I guess we can get into it now, 4 sessions, usually 2 weeks apart. They can be up to 5 weeks apart. And each session improves it upon the other. And then typically we're expecting about 1 maintenance per year, but significant differences that we can go into even after the first treatment.
Right. And the main thing here is it's painless, it's non-invasive, it's non-surgical, and it works. And we're going to talk about why it works in a minute, but it not only helps the dry eye, it actually targets pigment spots and irregular blood vessels that can actually contribute to inflammation. So it can actually improve the color and the texture of the skin as well. All right, we're getting ready to take the first call of the morning. Let's go. I think it's Sherry in Fort White. Sherry, thanks for holding. Good morning. Sherry, I think we lost her. All right, Sherry, give us a call back. I'm sorry. Sherry, 813-282-8283. That's 813-282-8283. And anybody out there, remember, I'm waiting for a call from Arizona. We get a lot of orders from Arizona at fortify.com. You guys and gals in Arizona are really in tune with nutrition. It's amazing. And the California crowd as well, and the New Mexico crowd. I guess further east, you think less about, all that delicious, fatty, sweet foods. Maybe. I don't know. But give us a call, 813-282-8283. So we talk about dry eye all the time on this program, and we like to talk about natural approaches to helping your dry eye without loading you up on medication or going into any type of surgical procedure. Now, obviously, we prescribe medications and recommend surgical procedures, but we try to get the body to work to its fullest potential. Remember, God made a pretty good body. As long as we give it the right fuel and treat it accordingly, it can perform at optimal levels and you can last a long time. So when we're talking about dry eye, we usually start out with proper lid hygiene. The eyelashes and the eyelids can be very dirty, believe it or not. They have a lot of bacteria and viral component, demodex mites, fungus, and things of that nature. So keeping your eyelashes clean is really crucial. And, in the olden days, Dr. Summerton, we used to recommend baby shampoo. And I guess that's better than nothing, but we have a lot of better options to baby shampoo now for lid hygiene, don't we?
We do. We've really come a long way in treating it, mostly because of our knowledge of what caused it. Back in the day, we just kind of thought you didn't have enough tears, but now most of it is due to evaporation. So there's 3 layers to your tears. There's a mucin kind of sticky layer. There's a watery layer that most people think of, but it's the oily layer that comes from those meibomian glands that we've been talking about. That if you don't have that nice protective oily layer, it's like trying to moisturize your skin with just water where it just evaporates. But you need that oily content, more like a lotion, to keep it hydrated and also smooth. If your tear film isn't smooth, you don't see clearly. So one of our biggest complaints of dry eye is blurry vision. So we need to get find ways to get the oil back into the tear film so that we can smooth it out and give patients that sharper vision that they're looking for. And also just comfort. We know if your eyes hurt, you're kind of miserable towards the end of the day. It's kind of like wearing an uncomfortable pair of shoes. If the eyes don't feel good, you don't feel good. So we're maximizing all the treatments that we can do and holding on to our values of keeping it as natural as possible.
Right. So once again, keep those eyelashes clean. When you're in the shower, scrub your eyelashes with a little shampoo or soap. That's better than nothing. But I like Optase tea tree oil lid wipes, and Optase also has a hypochlor solution. Those are very effective at decreasing the nasty bacterial, viral, and fungal flora on your eyelashes. So keep them really clean. And I always recommend heating them first. You know, heat them up really good, and then all the stuff oozes out of these glands. Then you kill them with the tea tree oil lid wipes or the hypochlor solution. And you can get both of those on fortify.com. Just go to the eye care section on fortify.com, and it talks about the lubricants and the lid wipes and things of this nature. And then make sure you're drinking enough water. You got enough potassium. Maybe eat a banana or an avocado. And a good lubricant that's preservative free, like Oasis Tears Plus or Optase. Those are my two favorites. And then remember, proper nutrition for the glands. So we heat them, we clean them, we lubricate them, and we nutrify them. And when it comes to proper nutrition for the glands, just go for the Bentley or Rolls Royce, and that's called Fortify Advanced Dry Eye Therapy. Fortify Advanced Dry Eye Therapy is a box, and it comes with 3 of our nutrients in it. 3 bottles. It comes with a super omega-3. It comes with Fortify Focus. That's lutein, zeaxanthin, and astaxanthin. And then black currant seed oil with 140 milligrams of what we call GLA. All of this works well together, synergistically together, decreasing inflammation in the entire body and in the eyes, helping the meibomian glands work a lot better. And then if you tried all this and it doesn't work, we got other things we can do. Punctal plugs, amniotic membranes, amniotic fluid drops, and then the IPL by Lumenis Opti Light. And we'll expand more on that in just a minute. Phone lines are open, 813-282-8283. That's 813-282-8283. And I see somebody chiming in on my Instagram. Dwight is asking, Dr. Lange, thanks for the show. I love listening to it. Many times you have talked about certain fruits that do not go well together. Please let me know what those are again so I can write them down this time. Thank you. So the fruits that don't go well together, that's a good one. So there is actually some scientific evidence that fruits that have polyphenol oxidase in them, that means when you cut this particular fruit or vegetable and it turns dark within 5 minutes, so that's like a banana, a pear, an apple, all right? It turns dark. That has polyphenol oxidase in it. And you don't want to combine that with berries that are high in flavonoids. So don't eat a banana, an apple, or pear with blueberries, strawberries, raspberries, anything like that, blackberries. You won't get the benefits of the flavonoids. You can eat apples, pears, and bananas, but eat them without the berries. And I used to make smoothies all the time, and I'm sure you did too, Dr. Summerton, where we take blueberries and bananas after we work out to get those carbohydrates to replenish muscle glycogen. Well, now we can do the banana, maybe a pineapple, just don't do the banana and blueberries, right? Yep. Okay. I must have lost Dr. Summerton, but she'll be coming back.
I'm back. I'm sorry. I just called back in. I lost you for about a minute there.
All right. So we were talking a little bit about the blueberries, how the flavonoids in berries can be, the benefits can be counteracted by polyphenol oxidase that's in certain fruits like bananas, apples, and pears. So we don't want to be combining those. And I was saying how we used to work out, well, we still work out a lot, but we might have in the past taken blueberries and bananas and combined them. We don't do that anymore, do we?
Right. And I know when you go into the stores and you order your smoothie, often banana is in pretty much all the choices. And so at home here, I found a little way, because banana tends to make it a little creamier, which I know most people like. I actually have found zucchini, and I freeze little cubes of zucchini and put that in the smoothie instead of the banana. And that's another way of getting some extra vegetables in there that just makes your smoothie more delicious.
Wow, zucchini, and that's a power antioxidant. So it's packed with a lot of different antioxidants that are very beneficial. We're getting ready to take call in just a second. But before we take that next call, I just want to mention yesterday we did a lot of people on the IPL. That's the intense pulse light therapy. And one of the gentlemen that we did, he's a younger gentleman, had LASIK surgery, had chronic, terrible dry eyes. And Dr. Summerton knows who we're talking about. She's been treating him for a while now. And we did the IPL on him. It was painless. It was about, 13, 14 minutes of procedure. And he texted me last night, saying that his eyes felt great. There was no pain, no inflammation, no redness, but they felt a lot less sandy, gritty, burny, teary, itchy, and he didn't have to use any lubricants at all. So he was very happy. But this morning, he sent me a nice text that I forwarded to Dr. Summerton, stating that for years now, and straight for the lubricating eye drop. And if he got up to urinate in the middle of the night, he had artificial tears by the bed to put them in his eye. Well, he said that's all gone. That was with one treatment. Remember, the IPL works best after 4 treatments, separated by 2 weeks between each treatment. So we're pretty excited about this, being able to help this gentleman who's had chronic, really bad dry eyes for a long time with a 15-minute non-invasive procedure. He's actually doing so much better, Dr. Summerton.
It is, and we love to hear those testimonies of how the treatments are working, because we want to make sure what we're doing is helping the patient. And this is something we haven't been able to do before, using that light technology that just gets rid of that inflammation, gets rid of those bacteria that are there, gets rid of any demodex that are there, helps those little tiny blood vessels that are there too, all in one treatment. And basically, if we're doing all that, we're not only helping the dry eye, we're actually making the lid look a whole lot better as well.
Right. So feel better and look better. What's wrong with that? And then if you add our Fortify Rejuvenate, and we're going to recommend that, maybe we'll give you a free container of Fortify Rejuvenate when you have the IPL. I think we'll just go ahead and do that. Rejuvenate, remember, is antioxidant powder that we've developed. There's a combination of the first marine collagen tripeptide, not a peptide, tripeptide, hyaluronic acid from Germany, rice ceramides, Dermaval, which is 9 superfoods, biotin, liposomal vitamin C made here in America, and a very mild multivitamin mixture in 4 different flavors and unflavored as well. And this is for benefiting the skin, the hair, the nails. So I think if we feed the skin with the nutrients that it thirsts for, then also taking a good omega-3 after having the IPL done and proper lid hygiene, then who knows, maybe you won't have to have it done ever again, but we're probably going to have to be doing an enhancement every year or so that won't be as expensive as the original. So a maintenance dose, if you will. All right, we're going to go to the phones. Let's see. I think Steve's been waiting patiently. Steve, good morning. Welcome to the program.
Yeah, I'm having trouble hearing you, so if you need to cut me off, feel free. I wanted to tell you, you know that man that with the brain cancer you were talking about, that you were going to try to help him?
Right.
One thing about brain cancer is that it can cause a lot of, I know this from knowing someone, it can cause a lot of variability in vision, because one day the edema changes, the other day because you have pressure behind the eye. Treatments can affect it too, so you might keep that in mind. Also, another thing is in brain cancer, as we know, vitamin C inhibits the multiplication of brain cells. And one thing you might think about is that vitamin C at the blood-brain barrier has a pump, and it makes it increases the amount of vitamin C in the brain 10 times. It actively pumps it in.
Wow.
Now, not only does it stop there, but each individual neuron has a secondary pump that increases it another 10 times, which means that most neurons have 100 times more vitamin C than most cells in the body. It's very important to the brain. So it's something you might think about.
Right. Yeah. Vitamin C is very advantageous for all aspects of our health. And especially right now during the viral season, a lot of you are vitamin C deficient. Now, think about this. A lot of you, one of the most vogue diets on the market right now is the carnivore diet. Well, folks, you're not getting a lot of vitamin C on the carnivore diet. So I usually recommend if you're on the carnivore diet, especially after working out, consume some fruits, oranges, blueberries, all right, strawberries, pomegranate, kiwi. These things also are very high in vitamin C. I like the carnivore diet. I like it for supper, sometimes for breakfast, but I think a little fruits and vegetables throughout the day is also going to be advantageous, and you want to have that nutritional deficiency. But remember, after you work out, and there's studies out that have proven you recover 40% faster if you have carbohydrates right after working out. So why not kill 3 birds with 1 stone and use a fruit that's high in flavonoids, high in vitamin C, and got the proper carbohydrate to replenish muscle glycogen? What do you think about that, Steve? After you come out of the gym, pumping iron, consuming some blueberries or some pomegranates.
Exactly. And another thing too is, if anybody out there has brain cancer, you might look into Jimmy Carter. He had brain cancer for almost 10 years, but they were able to completely keep it down. And anyone who has that problem might look into his protocol that they gave him at Emory. I believe it was Emory.
He ate a lot of peanuts.
Yeah. Well, and I think he had perfect teeth till he was 50 something, not one cavity. It was something amazing about him. And then another thing too, there is a drug for the brain, which is a stroke drug called Epsilon. And the sole mechanism by which Epsilon works is it's a vitamin C recycling agent. In other words, when the vitamin C comes into the brain and it turns into dehydroascorbic acid, it oxidizes. The Epsilon brings it back to the regular vitamin C. And yet, for some reason, the medical community doesn't admit that vitamin C is good for brain cancer, but yet they have a drug that its very mechanism is to increase the vitamin C.
Huh. Interesting.
I don't understand it.
All right,
okay,
Steve.
I'll let you go.
Thanks for the call.
Okay.
All right. I got to tell you, Steve always comes up with questions that makes you go, He's got some interesting questions. Now, Dr. Summerton, I'm surprised that Steve didn't. This is probably going to give him, if he's listening, an idea. He didn't talk about the pyramids lately. They've got some interesting science on the pyramids. I don't know if you all have been watching it. Joe Rogan spoke about it, and it's been on the news. It's been all over the internet about some strange columns and spring-looking devices that go 2 kilometers underneath the pyramids. So I'm surprised they didn't bring that up. I bet next week he will. So Dr. Summerton, he did bring up, thinking about the whole vitamin C thing. We see patients all the time that are on their specific, wonderful diet they claim is, curing everything in the world, right? We see people on the carnivore diet, the ketogenic diet, the paleo diet, the old Atkins diet, the plant paradox diet. We've worked on a diet called the Lange survival diet to try to give you the benefits of all of those diets. These people that are out there that are only eating red meat all day long, they're going to become deficient. And then think about it. I mean, I've tried the carnivore diet. I think you've tried it. And, we're athletes. I mean, we're in the gym quite a bit, working out, and pretty extreme. I mean, you do a lot of competitions. I do a lot of competitions. And when I was on the pure 100% carnivore diet, I did lose weight, but I lost muscle mass, believe it or not. And I didn't have the energy that I needed to recover. That's the main thing I saw, recovery. If I'm in the gym working out and I take the Fit Pro before and after, and I have some carbohydrates after, I can hit the gym the next day. I can bike 100 miles the next day, even if I biked 100 miles the day before. It's crazy. But if I'm on just strictly protein, my muscles aren't recovering. And there is direct evidence now, and you brought that to my attention not too long ago, about carbohydrate consumption after working out, isn't there?
Right. And it was saying, I believe you needed to eat it within 3 hours of finishing your workout because if you didn't, they actually proved it affected your performance the next day after. So even after you had rested, you still didn't have the same amount of energy that you did if you did not have that carbohydrate after you worked out. And also I wanted to bring up, we were talking about multivitamins, and then Steve was talking about the vitamin C and the cancers. And one of the things, kind of sidetracking here with the multivitamins, that Physicians Health Study and the Preventive Services Task Force review reported that taking a multivitamin, that total invasive cancer was reduced with a multivitamin supplementation. So we don't know what part of that multivitamin that was doing, but there was vitamin C in that. So that could be a part of the power of multivitamins. And even the multivitamins were associated with reduced risk of cataracts that we see on a daily basis, and slower age-related memory loss and cognitive decline. So we're talking about, we want a healthy diet for sure. That is the foundation. But you need these modern foods and how everything is processed and how they're not as powerful as they used to be. We need to supplement what we're not getting from the diet, because we on a daily basis are conscious of what we're eating, but still we have to add a little bit more bonus into getting those nutrients into us to fuel the body.
Right. So the study has been proven now that a good multivitamin can help promote overall wellness. And certainly we've got the Fortify Complete and the Fortify Next Gen Macular Defense that acts like a great multivitamin. So go to fortify.com, Fortifeye, fortify.com, and check that out. But there's definitive evidence. I mean, the studies are coming in all day long about fruits and vegetables. Eating more fruits and vegetables will help you live longer with less disease. Decreased risk of heart disease and lifespan. There's a study that came out March of 21 in the Journal of Circulation with over 2 million people for 30 years. And it showed that just adding 2 servings more of fruits and vegetables a day to the lousy 3 servings that we already have decreased the risk of dying from any cause dramatically, the risk of heart disease and stroke, also the risk of respiratory disease by 35%. So just by adding 2 extra servings, that's 5 servings of fruits and vegetables a day. And then when you conserve 10 servings of fruits and vegetables a day, it's amazing how much higher less percentage chance of getting diseases was. So fruits and vegetables are important. So once again, if you're on a strict carnivore diet, add some fruits, especially after you're working out. All right, we're going to take a couple of calls here. First, we're going to go to Jerry in Ocala, and then we'll go to Dr. Brooks, who's on hold. But Jerry in Ocala, good morning. Welcome to the program.
Thank you. Good morning, Dr. Lange. I got a couple of questions here. Do you have any help for UTI type of thing? It's infection, in the urethra. Right. On there, is there any of your products helpful in that area?
That's a great question. I mean, we discussed that with Dr. Poser a couple of weeks ago on here about UTIs. I mean, UTIs, usually got to get to the culprit of the problem, why you have it. You got to follow your doctor's advice. Usually you have to get on an antibiotic, an oral antibiotic, but consuming more fluids is very important. All right. Doctor, cranberries and pomegranates have been shown to be beneficial. Okay. But a lot more water. All right. And Dr. Poser had talked about apple cider vinegar, a tablespoon in the morning with water. So there's a lot of holistic things you can do for UTIs. And then also staying out of, when you're on that cruise ship, don't get in the jacuzzi that everybody's kid got into. So do some things preventatively so you don't catch that UTI. But, you gotta see your physician for that usually and get on an antibiotic.
Yeah, I've had the antibiotic, but I ate a bowl of jambalaya. Right. It's very hot, and the next day I seem to have a problem again. I'm not sure.
I don't think the jambalaya is causing a UTI, but the jambalaya can definitely irritate your urethra when you urinate because of all the hot and spicy food that's in it. All right.
Oh,
And
I see.
I grew up eating a lot of jambalaya being from New Orleans. And, there's some other things for good kidney health is, avoid almonds, avoid beets, and avoid spinach, believe it or not, because these are so high.
Oh, that's it.
Yes,
Oh, yeah.
they're so high
I
in
eat a lot of spinach.
oxalates. So you can consume kale instead of spinach, pistachios instead of, almonds, and just avoid the beets because kidney stones can occur from that, and kidney stones can be very, very painful. But remember, drink a lot of water, okay? Good bottled water or good filtered water.
Yeah, thank you. The other question I have is, you mentioned Dr. Snow. Can you give me the site to reach him? Or
Yeah, so you can go to his website. It's Dr. Health Radio, drhealthradio.com. And then you can tune in on 8:60 a.m. at noon. If you could just go to their website, The Answer, 8:60 a.m. at noon, and listen to the rebroadcast of my interview with him at noon today and at 7 p.m. tonight. But it's drhealthradio.com, okay?
Yes, thank you, Dr. Lange.
All right. Thank you, Jerry. All right, let's go to the famous Dr. Brooks. I think he's on hold. Dr. Brooks, good morning.
Good morning, Dr. Lange. How are you?
Fantastic. So you're calling in from Texas probably, aren't you?
That's right.
So what time is that? It's an hour different there, right?
Just an hour, yeah. So about 8:45.
So Dr. Brooks, would you let our listeners know, we're broadcasting on many stations in Texas right now. Let our listeners know, who you are and what you're doing and how we're working together.
Yes, that'd be great. Thank you. So my name is Dr. Brooks Wood, and I am based out of the North Dallas area. And I founded Urgent Eye Care about 4 years ago with the passion and goal to serve patients who are needing eye care after hours. And we found in many areas that, 8 to 5, Monday to Friday is the only time you're going to get eye care. But the eyes don't know 8 to 5. So there's people who were searching out, other care at their local urgent cares or ERs. And unfortunately, in many cases, they were under-equipped to be able to identify the problem and either supply or prescribe the best treatment. And we were seeing that permanent damage result when they were seen on Monday. And so we launched Urgent Eye Care, now have 2 locations in Dallas, and now, of course, partnering with you, Dr. Lange, and already seeing how we are, truly saving eyes and bringing peace to stressful situations when people fear the most. And we're also finding that urgent cares and ERs are excited to be able to not have to manage these eye care problems. And we've found tremendous success in supporting just our local community of healthcare providers and providing this free service. So
it's going to be a great addition for all the people that are in the Ocala, the Villages, Leesburg area, because now we'll have almost 24-hour eye care access through the Lange Eye Institute in the Villages. And I'm going to give you guys and gals a number, and you can write it down because we go live with this, I think, next Friday, which is just right around the corner. Dr. Brooks, do you have a phone number that people can write down?
Yes, that number is 972-922-7537.
Good. So write this down, folks.
Yep, 972-922-7537.
Perfect. One more time, I'm going to tell them 972-922-7537. Write this down, put it on your refrigerator, put it in front of your computer. You never know, Saturday afternoon at 3 o'clock or, Saturday night at 8 o'clock in the evening, you're out working in the garage and you get a piece of steel in your eye and you don't want to go to the emergency room and wait 14 hours to be seen. You want to be seen by an eye care provider at the Lange Eye Institute. Write this down, put it on your refrigerator, 972-922-7537. And we get some great doctors that are going to be on call. I'll be one of them that will take good care of you. So I think this is going to fill a huge niche that's needed, Dr. Brooks, in the area. I mean, I'm always on call anyway, but now these people are going to have, access that they don't realize. And also the urgent care facilities, the other doctors in the area now have a place they can send their patients that they can rest assured that they're going to get the best quality care, bar none, for their eye emergencies.
That's right. So we're very excited to be partnering with you, Dr. Lange, and we are looking for other partners across the nation to bring this exciting and, like I said, free service to more eye care professionals. In May, we are launching in South Carolina with Dr. McKinney at Crescent Eye Care. So we're looking for more of these forward-thinking optometrists like yourself to partner with and just to save those eyes, not to be too cheesy.
Beautiful. And then what we're going to have to do, you guys are going to have to come down to Florida and hang out, and then you can come be live on the show with us, and we can do a whole hour talking about this, okay?
I'd love it. That'd be exciting. Thank you, Dr. Lange.
All right. Thanks for the call. Bye-bye. All right. You're listening to Ask the Doctor. So anyway, at least we're going to have some care for all the people out there, Dr. Summerton. At least a number of people can call, and they can see an eye doctor that's going to know what's going on with their eye emergency versus going to an urgent care facility or an emergency room where you don't really want to inundate them with, a red eye or something like that. You want to see an eye doctor instead of an emergency room doctor. I think the care is going to be, what we're looking for the area. What do you think, Dr. Summerton?
I think so too. And a lot of it is having the right equipment to see what's going on. And you can only have so much equipment in an urgent care and an ER. But in our offices, obviously the equipment is all geared to looking at the eye. So it makes it a much more smoother and easier diagnosis to figure out what is going on.
Yep. All right. Let's open up the phone lines. We had a few people on hold. Give us a call. We'll take your calls. We got plenty of time. 813-282-8283. You're listening to Ask the Doctors. I'm Dr. Michael Lange and Dr. Susan Summerton of the Lange Eye Institute in the Villages, Florida, and Fortify Vitamins. Remember, you can get any of the supplements that we talk about at fortify.com. That's FORTIFEYE, fortify.com. It ships out of Tampa or ships out of Clearwater. And remember, we have the Nutrition Center in Ocala, Lange Nutrition Center, right across the street from the Paddock Mall, large 2-story building. Go upstairs and Mary can take care of all your nutritional needs. And also here in Clearwater, we have the Fortify Nutrition Center right on McMullen Booth Road, right next to Publix on the Bayside Bridge Plaza. And we're open on Saturdays until 3 at the Fortify Nutrition Center in Clearwater. But don't forget to come see us at the Lange Eye Institute in the Villages. If you're interested in having this new Lumenis Opti Light IPL treatment for dry eye, come on by, set up an appointment to see Dr. Summerton or myself, and we'll run a meibomianography test on you, look at the meibomian glands to see if they're working or they're not, and then we can set up an appointment, and we'll go over in detail what the IPL can potentially do for your dry eyes. So we talk a lot about omega-3 fish oil. We talk about omega-3 fish oil not only helping the heart and the brain and the skin and your nails and your hair, and now helping with muscle recovery, believe it or not. But there's an interesting study. I mean, so many companies, mainly big pharma, is always trying to knock how vitamins and supplements don't benefit you, obviously, because they want to sell more drugs, right? And we've just proven that multivitamins are beneficial. And now we're proving daily that omega-3 fish oil is beneficial. And a lot of people say, well, omega-3 from fish is the way you got to get it. But there's a new study that shows that fish oil supplements may be more effective than eating the oily fish. So this is new science showing that increasing the EPA and the DHA beyond what eating fish can do may be beneficial for the heart and the cardiovascular system. This is pretty interesting news, isn't it, Dr. Summerton?
It is, because we always do harp on eating the food, And perhaps because a lot of our fish these days is farm raised, that it doesn't have as high a omega-3 content as wild caught fish. And they did find, they were actually looking at the study for heart markers, and they found that eating oily fish versus taking the fish oil supplement, the supplement in triglyceride form is better at reducing those kind of harmful, what we call extracellular vesicles. Those are little tiny particles in the blood that promote like clotting and inflammation. And they actually found that fish oil supplement did a better job. Now, we don't want to say don't eat fish. Fish is still a good nutrient dense whole food that we want to have in your diet. But again, it's just adding that we need to supplement to really get those therapeutic levels to have a therapeutic effect.
Yep. So eat your fish or get your omega-3 fish oil, Fortify Super Omega and Fortify Super Omega-3 Max, top omega-3s, purest on the market. All right, let's go to Misty, and then we're going to go to Ron. We're going to have to talk quickly. We got 2 minutes. Misty in Tampa, thanks for holding. Good morning.
Good morning. How are you?
Fabulous. How are you?
I'm doing well. I'm calling in today because I have been newly diagnosed with thyroid cancer, and I'm really kind of looking as to how to eat my way out of it instead of just, the chemos and all of that stuff.
Wow. That's going to be a great question. And what I'm going to say, since we're running out of time, if you could email me, I got some really great information on that I can link you up. And then, because in 30 seconds, I'm not going to be able to cover this. Let me give you the email address. Okay. It's
okay. Perfect.
iDude92. So EYE and dude, DUDE 92 at iCloud.com. Shoot me an email and I'll link you up with a bunch of good information. Okay, Misty?
Perfect. Thank you so much.
All right, let's go to Ron. We got about 20 seconds for Ron. Ron, good morning. Welcome to the program.
Good morning. I'll make it quick, doctor. Listen, comment about your emergency service. About, 30 years ago, I woke up one Saturday morning and I was seeing spots and things all over my eye. I thought, something's wrong. Fortunately for me, I had a doctor next door, my eye doctor. I went over. He looked at me. He said, my God, I think you have a detached retina.
Right.
He opened his shop, went down, froze it until I could get proper surgery. So having someone available to you over the weekend is fantastic.
Thank you for that information, Ron, and we appreciate the feedback. You have a good one.
Same to you. Bye-bye.
All right, Dr. Summerton, as usual, we got only 20 seconds left, so you got 10 seconds to tell everybody goodbye.
Thank you, callers, for listening. Go enjoy your day. Spend some time outside. Eat some healthy food. God bless.
All right. Thanks for tuning in. I'm Dr. Michael Lange, helping keep America safe and healthy. I'm out of here. Have a great day. God bless you, and God bless America.